Thank you for joining us virtually for a press briefing. My name is Kelly Chandler. I am the Public Health Division Manager for Itasca County. Itasca County has hosted press briefings twice weekly, focusing on themes emerging in our community related to COVID-19 or frequently asked questions posed by our community members. Today, we'll focus on healthcare, testing, and prevention-related frequently asked questions. We are joined by Aaron Saudi, CEO of Big Fork Valley Hospital, Monique Fox, Administrator of Essentia Deer River Hospital and Clinics, Jean Mcdonald, President and CEO of Grand Itasca Clinic and Hospital, and they will speak on behalf of their organizations related to testing and other services reopening. After that, we will address common questions that are asked to our community, including questions related to masking, prevention, and testing, and what testing looks like. And we will have Dr. Thomas Howard, Chief Medical Officer of Essentia Deer River Hospital and Clinics, Dr. Steve Pitska, Emergency Department Medical Director from Essentia Deer River Hospital and Clinics, and Dr. Dan Suler, Vice President of Medical Affairs and Family Medicine Physician from Grand Itasca Clinic and Hospital, addressing some of those commonly asked questions. We are joined by our local and regional media. After our speakers, please submit questions via chat. We would like you to preface your questions with your name and the media organization that you represent. Our panel will respond to the questions that pertain to their organization. Before we move on to our facility updates, I will provide an update on COVID-19 numbers in Itasca County. We have 50 laboratory confirmed positive COVID-19 tests in Itasca County. Exposures include congregate settings, healthcare workers, domestic travel, direct contact with a known positive, and community spread. And when I refer to community spread, that means it's an unknown source of infection. We are very sorry to announce that we had another death of an Itasca County resident since our press briefing last Friday. It was a male in his 60s. To honor all of those who have lost their lives in Minnesota due to COVID-19, Tim Walz, our governor, has ordered all United States flags and Minnesota flags to be flown at half staff at all state and federal buildings in the state of Minnesota from sunrise until sunset, which begins today, Tuesday, May 19th, and will continue on the 19th of every month throughout 2020. We, along with the governor, will remember, mourn, and honor those who have lost their lives to COVID-19. Thank you to the community for joining us in honoring those who have been affected by this serious virus. I will now introduce Aaron Saudi, CEO of Big Fork Valley Hospital.
Thanks, Kelly. Thank you for the invitation to this briefing and the opportunity to share a brief update. Over the past couple of months, we've been preparing our organization and obtaining resources to respond to the COVID pandemic, with efforts focused on keeping our staff and our community as safe as possible. Over the last few weeks, Big Fork Valley has been able to increase our testing capabilities. In collaboration with Scenic Rivers Health Services, curbside testing was introduced and is now available to all symptomatic patients in accordance with the Minnesota Department of Health guidance. Last week, we implemented rapid on-site testing, which will be utilized to screen all hospitalized patients and emergency room transfers. We're utilizing the Minnesota Department of Health roadmap to schedule to re-implement surgical procedures beginning tomorrow. We plan to utilize our on-site rapid testing for all surgical patients the day of their procedure to ensure a safe environment for them and our staff. We've also begun reintroducing our outpatient services at a greater capacity. We've utilized the weeks allotted to us to plan and prepare for COVID-19, and we have used this time wisely to implement extra precautions to protect our community as we provide essential care to our patients. We want all of our patients to know that we're here for them when they need us, and we're prepared to provide quality care with extra precautions during this time.
Thank you, Aaron. I will now introduce Monique Fox, Administrator from Essentia Deer River Hospital and Clinics. You're muted, Monique.
Thanks. I was trying to remember that. Thank you. Thanks for the invite, Kelly. We've enjoyed the opportunity to work closely with and collaborate with our community members. And we are receiving a lot of positive feedback from our patients regarding the quality of the virtual visits that we are offering. And just to share some feedback, chemo patients are indicating that they're very grateful that there is reduced traffic in the hospital, which allows them to continue to get their treatments in a safe environment. Essentia has been able to expand in-house COVID-19 testing across 3 instrument platforms. To accommodate the flow of the COVID-19 orders, we have a 3-tiered approach, which includes stat testing orders, pre-op testing orders, and routine testing orders. This includes the ability to test residents in congregate living situations, OB patients, surgical patients, and healthcare workers. Expansion in testing has helped us to safely offer more face-to-face visits, surgeries, and procedures. Essentia has developed a clinic ramp-up safety checklist and safe surgery checklist that follows the MHA roadmap for surgeries plan to increase face-to-face visits gradually within departments and clinics, addressing signage, scheduling, social distancing, disinfection, PPE, and staff considerations. We will keep an eye on this as we increase our volumes in our clinics to make sure that we're able to keep our patients and staff safe. Local patients that thought they had COVID-19 have inquired if they've had antibody proven past disease, they can donate plasma for convalescent therapy. I will let Dr. Pitska respond to that a little bit later in the dialogue. We are also calling our patients to schedule their services that may have been delayed. We want our patients to know that we are doing everything we can to keep them safe. And one message that I would like to reiterate is we do offer a respiratory care clinic here if you have active respiratory symptoms that are not emergent, and you can call our appointment lines here in Deer River and Grand Rapids and be directed to a safe place to come over by the flagpole. You'll get escorted into the building to have your exam in person, and then if you need testing, we'll go ahead and schedule the testing for you there. So that's what I have for us right now. Thank you.
Thank you, Monique. And I will introduce Jean Mcdonald, President and CEO of Grand Itasca Clinic and Hospital.
Thanks, Kelly. At Grand Itasca, we're currently offering COVID-19 testing 7 days a week from 8 to 5. Those patients who are experiencing symptoms of COVID-19 can call our appointment line at 218-326-7344 and schedule a telephone visit with a provider. And then that provider will determine whether or not the patient needs testing and will give instructions for curbside testing at that time. We're currently testing symptomatic patients here who have had contact with someone who has COVID-19. If patients are symptomatic with pre-existing medical conditions or are over the age of 65, they will get tested. And of course, we're continuing to test symptomatic healthcare workers, emergency personnel, daycare providers, etc. If patients do have symptoms of COVID-19 and have had them more than 14 days ago and would like to be tested for the antibodies, they can also call that appointment line and request a telephone visit, and the provider will give instructions for a blood draw. And there's a lot of questions out there about the antibody test. There's a lot of research being done on the testing, but not yet a lot of proof on what the results mean. And I believe Dr. Suler will go into a little bit more detail on that in just a bit. And much like Erin and Monique, we at Grand Itasca are also starting to open up some services that we had shut down originally for COVID-19. We'll be starting to perform elective surgeries next week. We're following the roadmap put in place by the governor to safely perform those surgeries, and that includes testing all of the patients that are coming in for a procedure for COVID-19 72 hours prior to the surgery. And we're also working with others in the community to do some of that testing for them. We're testing many patients prior to admission to congregate living facilities. We restarted our appointments for mammograms, and we'll soon be opening up our cardiac rehab department for patient care. We're also providing a lot of care virtually through telephone, video, and e-visits. We've had a lot of positive feedback, as Monique said. We've had that here at Grand Itasca too. People have enjoyed having that option, and our staff have enjoyed it as well. We continue to offer in-person visits for other clinic appointments that can't wait, including well child visits for patients under 2 years old, joint injections, wound care, women's health, occupational health, and others. Our walk-in clinic is open 7 days a week from 8 to 5, and our ER is always open. So if you do need care, please don't hesitate to come in or to call us to schedule an appointment. We're ready to care for you safely. Thank you.
Thank you, Jean, and to all of our facility, hospital, clinic staff for joining us. And we will now move on to the prevention and testing frequently asked questions. The first topic we will begin with is masking, and I will discuss some of those questions. So the first question is how to wear a cloth mask, how to put it on, take it off, and care for it. The first piece that should always, first step that should always be done is to wash your hands with soap and water, and that is always preferable. I am not sitting by a sink right now, so I will use hand sanitizer. It's over 60% alcohol and will clean my hands. I will then take my mask, and I'm holding it by the elastic strings, and I will place it over my nose and under my chin. Very important that you're not allowing those areas of your mouth and nose that expel droplets to not be covered. If you see people wearing them under their nose or over their chin, that is an incorrect way to wear it. And we do, for that optimum protection, have it over the bridge of your nose, under your chin. Tighten as best you can with the straps to eliminate as much gapping on top and on the sides of the cheeks as possible. When you're wearing this mask, try not to grab or touch the front of it, if at all possible. One piece to keep in mind is the masks that are cloth made are not medical grade. Information on whether or not they should be worn has fluctuated throughout the COVID-19 response. Some of that is based on access to medical grade PPE or personal protective equipment for our healthcare workers. This mask is not going to prevent you from contracting a virus just based on the size of the particles. However, it can help prevent droplets from when you cough or sneeze and are unable to social distance from reaching others. We do not encourage you to purchase medical grade surgical or N95 masks, as these are continuing to be in short supply and are very much needed for our healthcare professionals. As far as care of the mask, depending on your use, launder daily, washing machine and dryer, launder if they're soiled or wet, and store them in a clean, dry space. Cloth face masks should not be used on young children under the age of 2, anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask itself. Once you are finished wearing the mask, remove it via the straps, and then again, repeat the hand washing or the hand sanitizer. One of the other questions, where can I access a mask? If you or a family member or one of your persons you're working with as far as clients are in need of a fabric mask, please contact Elders Circle and they will arrange for pickup. You can call their message line at 218-999-9233, extension 277, and you can leave a message and we'll arrange for pickup. You can email ecircle@elderscircle.org. Include your name and telephone number so they can respond to you. There is a limit of 2 masks per adult. They have the elastic style as well as the tie style to choose from. The tie style particularly works well so it doesn't interfere with someone who wears hearing aids. There is no cost associated with accessing these masks. However, donations are appreciated. We will now move on to some prevention questions, and Dr. Thomas Howard, Chief Medical Officer from Essentia Deer River, and Dr. Steve Pitska, Emergency Department Medical Director from Essentia, will address the following questions. First question, what is the best way to protect myself And part 2 will be what is the best way to protect others.
Thanks, Kelly. I think these are commonly answered with the same response, but I think it's good to first start by just reminding everybody how this disease is transmitted, and that's person to person, respiratory droplets, sneezing, coughing, or even talking. And another thing that we need to keep in mind is that there are studies are showing that there's asymptomatic patients out there that are carrying COVID. And so we don't know who has the disease. So all the more important to adhere to these guidelines. So the first is washing our hands. Now, Kelly mentioned that she's using a hand sanitizer, and she checked to make sure there's 60% alcohol in there. So each one of us should check our sanitizers because we need 60% alcohol in the sanitizer to be effective. Cover all surfaces of your hands and rub them until completely dry. Now, if you have access to soap and water, then wash your hands for 20 seconds. Also importantly with this is avoid touching your eyes, your nose, and your mouth. If you cough or sneeze, that's an indication that you need to wash your hands by the criteria that we just listed above. We have to continue avoiding close contact. Remember, our social distancing is 6 feet. We're to continue with that. Don't gather in groups. Avoid crowds. And avoid mass gatherings. Now, as Kelly succinctly put on how to wear a mask, I'll reiterate that in saying that when you go out in public, put your cloth mask on and make sure that's covering your mouth and your nose. What I found when I've gone into public places is that people have a tendency to let them slide down and not cover their nose anymore, or even sometimes they're wearing them around their neck as a gaiter. We need to keep them up and we need to appropriately fasten them, like Kelly had mentioned. And even though that we're wearing a mask, that does not allow us to close that 6-foot distance. We still need to wear a mask and we still need to maintain that social distancing. And lastly, it's really important that we clean and disinfect. We clean surfaces such as door handles, doorknobs, faucet handles, places that people commonly touch, our work areas. You know, when I come to work in the morning, even though the person prior to me has cleaned that surface, because I share an office, I clean that surface right when I get there, several times during the day, and at the end of the day when I leave. And also make sure that we keep dirty surfaces clean as well. If we adhere to these guidelines, we'll do a big part in helping prevent transmission of the disease.
Thank you. And our next question, as we're all experiencing isolation fatigue, is it still important to practice social distancing?
And I have one answer to that, and that is absolutely. You know, the virus is still here. We're still trying to prevent transmission. We still have people in our community that are elderly, people that have diabetes, have heart disease, have a history of stroke. Not only are we protecting ourselves, but we're protecting those people as well. And as we continue social distancing, wearing our cloth masks, we're reducing the transmission rate. And we're also flattening that curve that we've all heard about and talked about, and limiting the surge down the road. But that also plays a part in helping our healthcare workers provide adequate care to people that are coming in. So I would encourage people to continue with wearing their masks appropriately, continue the social distancing, and help prevent the transmission of COVID-19.
Thank you. And now we will move on to questions related to testing, which Dr. Dan Suhler, Vice President of Medical Affairs and Family Medicine Physician from Grand Itasca Clinic and Hospital, will address. First question, what should I do if I was in contact with someone who tested positive for COVID-19?
Thanks, Kelly. That's a great question. And as we are having more cases in the county, this is certainly a question we're getting asked daily. Close contact, I would say any family members or anybody living in the same household as that positive COVID patient. What we're recommending is that they too stay home from work and stay home from public places for a full 14 days. As Dr. Itasca commented, they are likely to become infected just with how infectious this virus is, but they may not have symptoms. And so we don't want them relying on symptoms to determine if they should be going out in public. They really should be staying home and helping protect those just in case they are an asymptomatic carrier. The other piece of this is the Minnesota Department of Health will do contact tracing with any positive patient. We try to get in front of that because the state is inundated with these positive cases and may not get to that patient or their contacts for a couple of days. And so, all the local healthcare organizations, we're trying to get in front of the state in terms of contacting those patients and contacts that they may have so we can keep others in our community safe.
Thank you. Our next question, what should I do if my test is positive? And what should I do if my test is negative?
Yeah, so positive tests, we know most 80 to 85% of patients with positive COVID tests do not need any medical care. They can recover quite well at home. And so if they're, when somebody is tested, we recommend that they quarantine themselves until they get the result back. And if they do get that positive result, they should quarantine for a full 14 days, isolation at home. They really want to quarantine themselves from other family members to help prevent spread. That may include sleeping in separate bedrooms, eating in separate eating areas throughout the house. We even recommend wearing masks throughout the house because the patient is already infected, but that cloth mask will help protect their family members. If the test result comes back negative, then it really comes down to two things. If it's negative and they are feeling fine, they have no symptoms, then we recommend that they can go on with their life as normal, of course, recognizing the stay-at-home measures of 6 feet social distancing, washing your hands, and whatnot. Now, if their test comes back negative and they do have symptoms such as a cough, shortness of breath, or fever, we recommend they act as if their test came back positive, because we do know that there are cases of false negatives in the community. And so even if the test comes back negative and you are feeling ill, you should still stay at home.
You addressed this already, but if you could clarify, is there a potential for false positives and false negatives?
Yeah, great question. So false negatives is really what we worry about in healthcare. And again, what that is somebody truly has the disease, but their test comes back negative. And what we worry about is that person with a negative test will then go out in the community and infect others. And the results or the rates of false negatives will vary depending on when that person is tested in that course of illness. If we test too early, they may not have enough virus for our test to pick up. If we test too late, they may already be over the illness. And so, that's really where we try to recommend to people that, if you're having symptoms within those first 72 hours, to get in and get tested. False positives is when your test comes back positive, but you do not have the disease. That does not happen all that often. And we really don't get too worried about that, because if you get a positive test result, you're going to quarantine yourself, and it may not be necessary, but that is the safer option. Is if you are positive, we assume it is a true positive and you should be staying at home.
Great. And our final question, what is an antibody test and why would someone want one?
Great question. So the test that we've been talking about so far is to test a patient if they have the disease at this time. That's the nasal swabs that you've heard about on the news. What we're switching to, or what is becoming more commonly spoken about now, is something called antibody testing. And antibodies are something that our body produces in response to being infected. So we get infected by coronavirus, our bodies will develop antibodies, which are white blood cells, to fight that infection. That antibody can take 10 to 14 days to appear in our blood. And so an antibody test is a test we do after an exposure to see if you've been exposed and developed antibodies. Now, you have to remember 6 months ago, there was no such thing as COVID-19. And so we are learning on the fly what antibodies mean. If you have antibodies, are you protected for the rest of your life? Are you protected for a couple of years? We don't know that, and we won't know that until time goes out and we can study this further. We suspect that some level of protection is inferred with having antibodies, but again, we don't know exactly what that means. And even if somebody has positive antibodies, as a healthcare worker, I would still wear my N95. I would still do all the recommendations we have to prevent passage of infection from one patient to the next. So it's a very good question. We don't have great answers. Antibodies can help you feel better that you've been exposed and you're over it. But again, I caution people that if you have positive antibodies, that's not a green flag to go out in public without masks and without social distancing. We're still learning as we go.
Thank you. We will now move on to the media question and answer portion of the press briefing. We have about 4 minutes, and we do have some questions already coming in. Everybody is fairly familiar with the process of identifying yourself and the organization you represent. First, from Kathy Lynn from KOZY, do we have an approximate number of tests that have been done in Itasca County? Public Health does not conduct the tests, so this is not a number we have readily available. I will ask the clinics and hospitals if this is something they can speak to at all. Jean or Dr. Suler, is this something you have information on?
Yeah, we are roughly at about 740 tests run through Itasca. We're averaging right now approximately 30 to 40 tests a day.
Monique from Essentia.
Sorry, we're unable to share that information from Essentia Policy. Thank you.
And Aaron from Big Fork Valley.
I would be able to share it if I knew it. I haven't gotten the latest update in the past week, so
Sure.
sorry.
Oh, that's okay. That is a commonly asked question. We see it on our social media quite a bit. So Heidi from KXC, of the confirmed COVID-19 cases and congregate care, is it anywhere besides the Emeralds or the group home mentioned in a prior media update? We are unable to disclose the living location of our other positive tests. Second part, can you divulge the number of confirmed cases at the Emeralds as of today? No, that is not information we have available. Britta from Herald Review, how long does it take to receive confirmation from the state after a person is tested? Do we want to address that perhaps from each facility depending on where the testing is sent out? Do you want to start from Grand Itasca?
Yeah, I'd be happy to share. So we have both an in-house rapid test that we get the results within a 90-minute turnaround time. We have a very small amount of those tests available. A vast majority of our tests are being sent down to Fairview, and we generally will get those back from between 48 and 72 hours after the test is run.
Okay. Monique from Essentia or Dr. Pitska?
Dr. Pitska, do you want to go ahead and share? Typically, we're 3 to 5 days for our send outs to MDH, but we do have the rapid test that we can do here on site, and I think it's about 90 minutes. And then we also have another one that we can do in Duluth and send, and I believe that one's about a 24-hour turnaround. Dr. Pitska, if you want to confirm those.
Correct. That's correct.
And Aaron from Big Fork, what is your turnaround time for testing?
We have the similar turnaround time when we send samples to the Minnesota Department of Health and in-house, but we are utilizing LabCorp for our reference lab, and we are getting those back within a 72-hour time frame.
Great. We are down to 1 more minute, and I am not seeing more questions. All right, thank you for attending our press briefing today.